My youngest son, Alex, he's 34 years old. He was diagnosed with autism when he was about 3.5. When you go to the doctor, you walk in the door.
I walk in the door.
And what do they do?
And what do? They want to do this.
Blood pressure.
Blood pressure.
I think that is your favorite part.
Yes.
The blood pressure cuff.
But I like the surgeon to make my stomach feel better again.
Get your blood pressure.
I want to watch, okay?
Intellectual and developmental disabilities are technically defined living with an IQ of 70 or less, and or living with adaptive behavior deficits. The prevalence of people with intellectual and developmental disabilities is generally around 1.5%. In Colorado, a state of about 5 million people, that would be 75,000 kids and adults across the lifespan with intellectual and developmental disabilities. Typical clinics, they're not completely equipped to interact with characteristics that are common to patients with intellectual and developmental disabilities. Our clinic, Developmental Disabilities Health Center, is a healthcare collaborative. The Resource Exchange is one of the partners currently. We are, in essence, a single entry point for all developmental disability services. Our core services include early intervention, family services and supports, as well as case management across the lifespan.
All right, are you ready to go in? Yes! All right.
I think doctors that are seeing adult patients with intellectual and developmental disabilities have a much more difficult time adjusting to the cognitive levels of our folks and the communication disorders of our folks.
Have a seat right there, sweetie.
Many are going to be able to talk with you just like I'm talking with you. Others may talk a little, others may not talk at all.
The physician has to sort through, how do I extract the information that I need to deliver really great healthcare? We always want to engage the patient, notwithstanding communication limitations, in the healthcare relationship.
Hi, Katria.
Hi, Dad!
How are you today?
I sit.
Some of the biggest roadblocks or barriers that I've seen for patients with intellectual or developmental disabilities is just a misunderstanding of their needs as far as their health care goes.
So sore throat, anything else? Your ears?
I got you.
Their disabilities can overshadow just their basic health care needs, and those often get overlooked.
So people with intellectual and developmental disabilities, they come with a set of characteristics, particularly in cases or with folks with autism. We find that legitimate medical concerns are either overlooked or not caught in the first place at all.
That's how he ended up with a terrible diagnosis of reflux. He was in horrible pain. We literally didn't know it for 5 years. But the way he communicated that was through self-injurious behavior. So he would hit himself and hit himself in the head and hit himself on the leg. We knew there was something wrong, but because the pediatrician had known him for so long, they said, well, this is just the autism. This is just the autism. I said, I don't think it is. And come to find out, he had the beginnings of Barrett's esophagus.
In this population, this is where your physical exam and the skills and ability to physically assess a patient are so much more important. You know, keeping it simple, start from the basics, start with a good history.
The caregiver is there as a source of information for the healthcare provider, remembering that the primary dialogue has got to be between the healthcare provider and the patient, him or herself.
Especially anytime I need a new patient, I always directly address the patient first. Don't automatically assume they're nonverbal, non-communicative, and have no role in their care. So I always introduce myself and try to gather as much information from the individual themselves, while also taking in and respecting the information that is provided by a caregiver. They can be a great wealth of knowledge that we really need to tap into.
We have made physical accommodations to the clinic itself. We've got a massive, massive waiting room that allows people their own space. It doesn't sound important, and yet it's critically important. And we've got 3 very large examination rooms that most people in the industry would recognize as procedure rooms. We do that so that folks in wheelchairs can access the space comfortably. And if someone wants to bring in 6 people from their family and caregiving team because that is what makes them feel comfortable and at ease in the context of an examination, that's what we do. Every morning, there is a list of patients who are scheduled for appointments on the day. We review those patients before the clinic opens to patient business, for example, and so we know who's coming in and what their needs are. We get the vitals taken care of straight away, and then we get the provider into the examination room to conduct the examination. And so it's really about person-centered planning in the context of healthcare delivery.
The reason that the primary care physician is so important is that we really need somebody who's going to focus on the whole person.
It is quite common, in fact, among people with intellectual disabilities to experience comorbidities like depression, like anxiety, and other forms of mental health concerns. This frustrates parents and people with intellectual disabilities enormously because they just want access to great health care and they can't find places around communities where they can receive that health care in a way that allows the person to be who they are. And sometimes that's going to come with some behavioral health concerns in the context of the clinical setting. For us, it's part of what we expect to see, and so it's not unusual, it's not intimidating or off-putting in any way. It's just part of what we expect to see and what we expect to interact with. Behavioral health for adults with intellectual and developmental disabilities in communities across the country, let alone in Colorado, is lacking, severely lacking. Insofar as integrating in a meaningful way behavioral and mental health with physical health, that is something that we need to, as a community, as a state, pay real close attention to.
Thank you. Thank you so much, Brett. It's always good to see you.
Developing a trusting caregiver relationship with any patient is critical to your ability to deliver the highest quality of whole person care. When working with people who have intellectual and developmental disabilities, the challenges can be even more complex because other people are involved in the person's life. Here are some key reminders. Be aware of who is in the room with you and your patient. Ask the patient if it is okay to talk about their medical issues in front of the caregiver present. Never assume it is okay. Never assume the person with IDD is unable to provide their permission. Direct your questions and comments to the patient first. Never assume the patient can't respond or engage with you. Be aware that the patient's communication style may be different to what you're used to. Know who the decision maker is: the patient, the caregiver, the guardian, or someone else with medical durable power of attorney. Protect the patient's HIPAA rights. If you need further assistance with these issues, please refer to the resources section of this module for helpful links.